Embryo transfers in IVF. It's a very delicate, sacred ritual. A life has been planted to the womb and it grows for 9 months. So this process is very important in IVF. Most of the time, women wonder, is there any early symptom where I can feel that I'm pregnant after this process? So there are some symptoms like mild cramps in the abdomen, sometimes bloating sensation, and some people experience mood swings and breast tenderness. And also, some of them can have mild spotting. Mild spotting is a good symptom. Most of them get worried here. We call it as an implantation bleeding. It's usually spotting, it's not fresh blood. Having said that, most of the symptoms are because of the hormones, injections and tablets what we give also. Because progesterone hormones causes bloating sensation. End of the day, beta HCG done after 14th day of embryo transfer is the authentic test. Any value above 100 is correct for the pregnancy positive. And many people ask about do's and don'ts after embryo transfer. Do's, that is things which you need to do. First, take the medicine at the right time. Sometime, 1 or 2 hours here and there doesn't matter. You don't have to panic. But at least don't miss the dose on the regular basis. Second is don't worry too much. Most of the time, there is a lot of misconception. If I do just lift little weight, will something happen to my baby? Nothing. Don't worry at all. And then sleep. Very important. Most of the time, ladies feel after embryo transfer, I just have to lie down. But then it doesn't matter. You have to sleep. A good 8 hours of sleep is important, especially in the night, because in the night melatonin get released and your hormone become balanced and it's a soothing sleep. And now about don'ts. Don't sleep all the time. It's not at all good. Research has proven that, rest after embryo transfer, no rest. In fact, pregnancy rates are better when you don't take too much of, don't sleep for too much of time. So having said that, about exercise, you can do your regular walking, mild yoga also is okay, but don't lift too much of heavy weights or too much of bending. You can avoid. And some people don't quit their job. Please don't do that. The more you are indulged in your routine activities, better. In fact, we have many experience and also data shows that mind should be occupied. You don't have to only, stay at home not doing anything. Interestingly, one of a patient today asked whether she can cook because she'll be exposed to heat. Of course, she can cook. She can do routine activities at home. Another important don't is smoking. Not only the ladies, the gentlemen. Passive smoking can also affect, and alcohol, better to avoid. Having said that, embryo transfer, especially post-ET, nothing, is there something where it's in your control. Most of the time, implantation happens in 4 or 5 days as soon as we transfer the embryo. So, depends upon many other conditions. But end of the day, this journey should be fertility journey should be also a positive journey for people who have undergone this process. At the end, the key is to be happy and hope for the best.